Bismillahirrahmanirrahim. So today we are going to make short videos regarding the models of the lower limb. This is just for the practical purpose. All theoretical purpose you have the lectures which has been given to you and also the workbook. So here today we are here to just look at the different models of the bones and the muscles which are probably going to be with you in your OSCE exam. So let's start with the hip bone. So why this hip bone is important for you? Because it gives attachment to some of the very important muscles of the lower limb. Okay, so I'm not going to detail about what are the different parts that you already know, but let's recap it. This is the ilium, this part is the ischium, and this is the body. This is the pubis, beg your pardon. So ilium, ischium, and the pubis, which has superior inferior ramus. In mind and movement, we are not supposed to know about the details of this bone, but for the purpose of knowing the attachment of some of the important muscle of the lower limb, we have to know it. So the first very important part is the ischium or the ischial tuberosity. Now how they are going to ask you, they are going to ask you that identify this bone or this part of the bone. Then you have to say that this is ischial tuberosity, this all is the ischial tuberosity, and which group of muscles are attached here. So then you have to tell that the muscle of the posterior thigh, that we used to call it the hamstring muscle. So you have to name all the muscles which are attached to the ischial tuberosity, maybe in the OSCE, maybe in the MEQ exam, or maybe in the MC exam. So if you are asked to write the name of 3 muscles which gets attached to the ischial tuberosity, then you have to name it. So ischial tuberosity is there, and which muscle groups are attached, this is theoretical part, you can go and say this. The next important part of this bone is the pubis, which is having the superior inferior ramus. Now pubis, you can see, is the medial part of the bone, and it gives attachment to the medial muscle of the thigh. So what are the medial muscle of the thigh? That I'd start from the gracilis and adductor muscles, adductor longus, magnus, and brevis. So if it is asked in the exam that what are the muscles that are attached to the pubis, then you can say the muscle of the medial compartment of the thigh. So adductor muscles as well as the gracilis, they're all muscles of the medial compartment of the thigh. Now these two important parts, the ischial tuberosity and the pubis, and then comes to this part, the upper expanded part, that we call as the ilium. And the uppermost part of the ilium is the iliac crest, and you can see anteriorly we have 2 important bony landmark, that is anterior superior iliac spine and anterior inferior iliac spine. Similarly on the posterior we have posterior superior and posterior inferior. That nobody is going to ask you this. Now iliac is having 2 surfaces, one is the anteromedial surface and one is the posteromedial surface. Now these 2 surfaces give attachment to some of the important muscle of the lower limb. Now start from this iliac, the anteromedial surface of the iliac bone, it gives attachment to the iliacus, that is the muscle of the anterior compartment of the thigh. Now you can see that orientation here, this anteromedial surface, so the muscle which are coming is going to the anterior compartment of the thigh. Similarly, there is a spine here that we used to call as anterior superior iliac spine. This spine is again important because it gives attachment to 2 very important structure. One is the sartorius muscle. Again, the sartorius muscle is muscle of the anterior compartment of the thigh, and it is the longest muscle of the body. So remember this anterior superior spine for the attachment of the sartorius, as well as it also gives attachment to the inguinal ligament. Now inguinal ligament is from anterior superior iliac spine to the pubic tubercle. So this anterior superior spine gives 1 muscle and 1 attachment. So what is the ligament here? The ligament is the inguinal ligament, which is attached to anterior superior spine and to the pubic tubercle. So remember this is again important landmark, the inguinal ligament. Okay. Similarly, the anterior inferior iliac spine gives attachment to one of the muscle of the quadriceps femoris. Again, the quadriceps femoris is having 4 components, that we know that we have the rectus femoris and 3 vasti. The rectus femoris is one of the muscle which is taking origin from the anterior inferior iliac spine. So all other muscles are taking origin from the femur itself, but only one muscle, that is the rectus femoris, is taking origin from the anterior inferior iliac spine. So you have to know about this. Then let's come to the posterolateral surface. The posterolateral surface is for the attachment of the muscle of the gluteal region. Now here you have seen that this is the ischial tuberosity, and this is below. You can see that this ischial tuberosity is below the posterolateral surface of the iliac bone. So this gives attachment to the muscles of the posterior thigh that we used to call as the hamstring muscle. So this bone, this posterolateral surface is above the ischial tuberosity. So this posterolateral surface gives attachment to muscle of the gluteal region that we used to call as gluteus maximus, medius, minimus, and the tensor fasciae lata. So these gluteus muscles, maximus, medius, and minimus, are from this posterolateral surface, but the tensor fasciae lata is from the iliac crest. So these are the different muscle groups, and these are the some important bony landmark which is important for you to know. Okay, I repeat again. We have ischial tuberosity, we have the pubic bone, and then we have the ilium. So this is about this hip bone.